behavior actions. We're here to talk about universal health care, our current healthcare system. Healthcare is an important problem, and it is getting worse. Southern Indiana has seen hospitals close. We've seen, I think, nationwide 104 hospitals close in the last decade or less. We have 4 hospitals that are in threat in the 9th District here in Indiana, Southern Indiana. People are struggling to make their insurance payments and pay bills, and it's really impacting people's lives. So tonight, we're going to do 6 things. Number 1, we're going to start with a discussion on what the current healthcare system is, and then we're going to talk about the health of that current system, and then how our system compares to other countries. Number 4, we'll talk about the projected impact of the big, beautiful bill, and then options on making healthcare better, and then we're going to open it up for questions. Right? So let's go ahead and get started. If you look at the healthcare system, it began with, I guess I'll put it up here so everybody can see, a completely free market system that ended in 1906. There is no system in the United States that's a completely free market, but it had for-profit doctors, for-profit providers, for-profit insurance, and the administration was for-profit, and then regulation was absolutely minimal, right? In 1906, they started they started the Food and Drug Administration, and between this period of time, starting really in the 1920s, the system that we currently have today for the for-profit system began to come into place, where the doctors, providers, and insurance and the administration was all for-profit, and then the regulation, there were at least health regulations. Then in 1930, way over here at the other extreme of the systems, we had a full government system come in 1930. The doctor, the provider, the insurance, the administration, and the regulation was all completely government controlled, and the regulation was not just on what people could do, but they had full control of the system. And that system is, anybody got a guess on what that system is? VA. The VA, right? So then in 1965, Medicare Parts A and B, and I don't remember exactly when D came in, but A and B, the standard Medicare came in. And that was for-profit, doctor, provider. The insurance was really through the government. The administration was government, and they set rates. So it's about halfway in between, maybe here, if you wanted to be really precise about it. And then we have a couple more systems that came in. 1992, probably right about here, Medicare Part G came in, and honestly, I don't know a lot about Medicare Part G. I have started getting calls telling me I needed to sign up for Medicare. I'm not that old. I'm really tired of the calls. When I go to Congress, those calls are going to stop, right? But it's almost entirely for-profit, but the regulation, there's supplemental regulations, so it's a little bit more than the private insurance system, and it involves the government a little bit more. And then in 1997, we got Medicare Part C, which is probably right about here. The doctor, the provider, and the insurance is for-profit. The administration is kind of a hybrid between the two, between government and private. And the regulation, there's more regulation than these over here. And that leaves this lonely little guy over here, which is the Affordable Care Act, which came in 2010. And what it was an attempt to leverage as much as possible with regulation this system, right? So the doctor is still for profit, the provider's for profit, the insurance is for profit, the administration is pretty much for profit. The regulation is more than the current system. This is our system, which is kind of a hybrid of many systems and is somewhat fragmented. And that turns out to be important. The fragmentation is a problem. So before we talk about how this system affects us, I want to talk about the relative health of what this system is, right? So 140 hospitals have closed between 2010 and 2014, with hundreds more considered at risk. Hospitals are reducing services like eliminating maternity wards. In some cases, they're eliminating the emergency rooms. And for sure, there are hospitals right now today that are eliminating, some of the security that they're supposed to have for the nurses and doctors. There's a growing doctor shortage. There's skyrocketing costs that continue to go much higher than inflation. And about 7% of people in the United States don't have health insurance. And tens of millions of people are carrying medical debt, despite 80% of them having health insurance. So the health insurance doesn't protect you from ending up in debt. And the problems aren't an isolated failure. It is because of the fragmentation, and I will argue a little bit later, it is baked into the way the system is because it is a for-profit system. And the for-profit system is not profiting us. So let's compare to other systems. You see that we have a whole bunch of systems clustered around here, and we've got this big gap over here. So you can look at each individual one and say, well, how well does this do for each person? But what is there anything in here? There's not anything really in the United States. But if you look around the world, and these are approximations, right? It's being recorded, by the way. This evening is being recorded, so just be aware of that. But roughly, I think the Swiss system is about here compared to our system. And then Germany and France, and the Netherlands and Denmark, and Canada, and Sweden and Norway, and then pretty much the English system, the UK system is pretty much right about here, okay? So the rest of the industrialized world lives pretty much in this area, while we exist pretty much in this area. And you say, okay, so what's the difference, left and right? Uninsured in the United States, 7%. Uninsured in France, less than 1%. Coverage system is based on your job. By the way, how many people have car insurance? How many people have car insurance through their employer? None. Why do we have our health care through our employer? It's just odd. It's, the only reason we don't think it's odd is we grew up in that system, right? Cost per person, about $13,000 per person versus $6,000 in Europe on average. Households with medical debt, 36%, 80% of those have health insurance. Germany, which surprised me that it's even this high, 17%. Bankruptcies caused by medical debt, 2 out of 3. 8%. Infant death rate per 1,000 live births, 5.4, 3.3. Maternal death rates per 100,000 women, 22, 7. Life expectancy, 77, 81. This is how the system is doing for us. This for-profit system isn't profiting us. And it costs, as I said, twice as much to run this system in which we die 4 to 7 years earlier. And by the way, in Indiana, it's worse. We are 39th in life expectancy in the United States. So this 4-year gap, it's worse in Indiana. It's more like a 7-year gap between Europe and Indiana. And in southern Indiana, it's worse than that. So that's where we're at today. So a lot of people, rightfully, in my opinion, are stirred up about the big beautiful bill, which I've been advised I'm not supposed to use that term. I'm supposed to use something else, but I'm trying to be as nonpartisan as I can be in this, although I am running as a Democrat. So we have a fragmented system, and they're adding changes to it that if you ask the supporters, they're going to say it's going to save money, it's going to get rid of fraud, waste, and abuse, it's going to make things better. If you ask the Democrats, they will say that it's going to be a calamity. And you go, okay, I understand why the Republicans would say what they put forward is going to work really well, and I understand why the Democrats would be against it, so how do I know what the truth is, right? So you can go to an independent source, such as the Congressional Budget Office. They estimate that Medicare provisions will increase the number of uninsured people by millions. This big, beautiful bill, not going to be so beautiful for millions of people that are going to become uninsured as a result of it. You could go to the Kaiser Family Foundation that reports that Medicaid spending is going to be cut by $911 billion over the next 10 years. And that's not fraud, waste, and abuse. That's cutting services that people honestly need. And Medicaid, which I didn't put up here, Medicaid is for the poorest of us. So we're going to cut $911 billion. And you go, well, okay, that doesn't sound good, right? And I'll tell you why I believe, setting aside partisan views, why I believe that this big, beautiful bill is going to be bad and hurt a lot of people. Number one, Trump stated April 2nd of this year, it is not possible for us to take care of daycare, Medicaid, Medicare, all those individual things. We can't do it at the federal level. We have to take care of one thing, military protection. Okay. So he has explicitly said that we are going to sink this system because we need to put all of our money into the military. That's exactly what he said. And I believe him, that is what it really is. Now you can't put a bill through that says that you're going to hurt a bunch of people, so you have to say that it sounds good, but apparently once it's passed, you can say that it's going to hurt people. Right? And the other reason that I believe, and this is the biggest reason that I believe it's going to be a problem, if the big, beautiful bill was really going to help a lot of people, by show of hands, do you think that he would have made the benefits effective before the election to get as many votes as possible? By show of hands, how many people would have do you really think he would have done it before, right? Or if it was going to hurt people, do you think he would have done it after, right? So he told us what it was going to do, and then he made the effects after the election. There's no question in my mind that the Kaiser Family Foundation and the OMB are telling the truth. And we're already hearing the reports. The people in the business that really know what they're talking about, the ACA subsidies have already been cut and caused massive increases Families with adults, children are already seeing the impacts of some of the early things where they're increasing bureaucracy, making it more denial-based and making it more complex so that parents will just give up getting the support that their children need. That's really what's happening. And rural hospitals are already cutting services in preparation for what's going to happen when the bill takes effect. So, kind of a downer, sorry. So what can we do about it? What are the options? And there are 4 options. We can strengthen and restore the Affordable Care Act. And what that really does, and we do need to do that, that's important, right? But what it's really doing is they have moved the ball, and we're going to move it back to 2024. And 2024 wasn't all that great. People were struggling to pay for their medical debt. They were struggling to get insurance. They were struggling with getting access. So 100% agree, it is necessary but not sufficient to address our healthcare problem by getting the ACA back where it was, in my opinion. The second one is what's called a public option. And the public option says the government can remove the requirement for Medicare for all, or Medicare, that anybody can get on Medicare if they want to. So we've got this, and also private insurance. And we'll let the market sort it out. And that's a valid argument. And there are people that advocate for it. I'm not one of them, and I want to tell you why. Private insurance, when the ACA came through their lobbyists, tried 100 times in Congress to kill the ACA entirely. 60 times in the Senate, they tried to kill the ACA. And when they couldn't kill it, they began undermining it and undercutting it and weakening it and removing provisions and making it more and more expensive so that it didn't do as well. It has been clear and demonstrated that the for-profit insurance system will never live in peace and coexist and compete fairly with anything that the government does. And to be more cynical about it, Medicare, these other systems, Medicare Part C and Part G, they cover and they answer some things. Great, got it. Pulling insurance in for profit. If we wanted the benefits of Medicare Part G and benefits of Medicare Part C, we could have just put it into Medicare. We didn't have to come up with systems that brought the for-profit systems in. We didn't have to do it. But the lobbyists got it in. And they're cutting and squeezing down on Medicare, and Congress is cutting and making Medicare and certainly Medicaid less and less attractive, so fewer and fewer hospitals and doctors will even accept it. They're keeping the rates down low enough that it's unattractive to the providers. That's done on purpose. It is an intentional attempt to weaken and undermine and undercut any system that isn't this. I don't trust the private insurance companies to compete fairly. And that's why I don't think that a public option is the right answer. Other people, actually not me, other people have said full government control. They just take over everything. Instead of going for Medicare for all, go VA for all. And honestly, I don't love that idea. I don't love the idea that doctors and providers are all government employees. I do like the doctors and the providers to be able to work independently and compete rather than be under one system, right? So that leaves us with Medicare for all. What I'm advocating for is that we just remove one line out of the Medicare that says, 65 and over. Everyone in the United States gets covered under one system. Single payer that makes it easier for the provider and helps you not put doctors behind paywalls, right? So that's my position. All right, so we're going to open up the floor for discussion. So I'm going to move this down, and while I'm moving this down, I will go over a couple of rules. Number one, if you have a question or comment, come up to the microphone so that everybody can hear you. And then number two, please try to keep your questions short so that we can have a meaningful discussion and input from the panel. I guess if I were 2% smarter, I would have just moved these out of the way. And then the program is being recorded, so please keep your questions PG, right? And then each person gets to ask one question before the next person before anybody asks a second question. And then out of respect for others, questions need to be on topic. This is about healthcare, not about other things. And the first question, I'm going to give the honor of that to Ron Meyer, who is running for the State Senate District 27. And that covers Henry, Wayne, Union, Eastern, and half of Franklin. And I'd like to introduce the panel. We have Simon Higgs. And Simon, if you can come up to the microphone and introduce yourself, that'll give me an opportunity to start clearing some of this.
Hi, my name is Simon Higgs. I used to work with the VA and helped develop their CHCS2 medical record system. So I don't have a medical background as a doctor or a physician, but I come from the essentially how to reverse business processes and create the medical record system and web enable it. That was something I built the demo back in 1998. I got squirreled away and hidden in a hotel room for a week or two. I handed it over to my boss once it was completed. The next day, he took it to the Secretary of Defense, and the Secretary of Defense dropped $120 million on it. I wish I got commission off that. Currently, that system has evolved into the medical record system for TRICARE, and there's currently 9 million active service members and their families using it.
Thank you. Next up, Michelle Wilhelm.
Good evening. My name is Michelle Wilhelm. I'm a little closer. Okay. Closer. Okay.
Perfect.
My name is Michelle Wilhelm. I'm a former paramedic, home health care nurse, and currently work in the ER. I've had the benefit from seeing the user end of care and the challenges that people face. It's not a statistic. It's our neighbors, mothers, fathers, children who are unable to decide where their parents get their insurance from, or even if they have insurance. And I've seen them do the best they can to navigate a system that is not set up for them to navigate successfully.
And the last, but certainly not least, is Dr. Bob Shoemaker.
Hi, my name is Bob Shoemaker. I'm a retired pediatrician. I was an academic pediatrician, a professor of pediatrics. I took care of children with lung diseases and sleep problems and children who were dependent on ventilators. And I spent my career helping children fight lifelong diseases, sometimes losing, helping children stuck on ventilators get out of the hospital and go home and go to school, carrying their little ventilator in a wagon behind them, yes. And I have experienced so many different problems with the for-profit system that I wish I could tell you in greater detail. But I'll give you a little clue, and that is it's somewhere over 50% now of physicians in this country support Medicare for all. That has changed in the last 10 or 15 years. You know, there was a pretty good support for it. It was higher than that even for the Affordable Care Act because it seemed to help a lot more people get coverage. And that's what doctors hate most of all, is when we know what the patient needs and there's no way to get it for them. Okay, that's agonizing. I like to tell you when Affordable Care Act got passed, I was very pleased, and my wife told me, yes, but they'll fight it and undermine it and eventually kill it, and then there won't be any other way but Medicare for all. She saw it in 2010, and you know, as I am fond of saying, my wife is usually right. So I'm happy to be here. Thank you.
Thank you. Ron?
Thank you so much for organizing this health forum, getting this organized, and thank you for being willing to participate. As he mentioned, I am running for state senate, and as he mentioned also, we've been experiencing physician shortages. There are hospitals at risk of closure. I think I read that there's between 10 and 15% of the hospitals in the state of Indiana are on the at-risk list. And as things are being closed, you have longer travel times for care. Particularly at the state level, since that would be something that I might be able to influence if I'm in the Senate, could you recommend one policy change that would have the greatest impact on improving access to healthcare in rural areas over the next 5 years? What would it be and why?
I am by no means a policy expert. However, a lot of the pressure on the hospitals, none of the rural hospitals are going to make it. In 10 years, they'll all be gone if we don't do something. We've seen our rural hospitals be swallowed up by larger systems just to keep their doors open. The problem with hospitals is they provide the service and then they spend millions of dollars each year working with the insurance companies to try to get paid. It's not sustainable. 40% of children born in this country are born and paid for by Medicaid. OBGYN care, labor and delivery is some of the most expensive, labor-intensive care that hospitals have, and it is not profitable. It never will be, and it's the first thing that small hospitals have to get rid of in order to stay financially stable. We're going to see labor and delivery leave a lot of our hospitals. I work in the Cincinnati market and I work for Mercy, and they have had to close down all their labor and delivery. They have one remaining out of the 5th largest system, nonprofit system in our country, are closing their doors for labor and delivery. One of the things that a universal payer system will do is shore up our rural hospitals and make sure they get the funding to provide the care to the families that live and work in that area.
I add one thing. If you're like, if you get elected and we go to Indianapolis, what could the state legislature and the governor do after January 6th or whenever you guys get sworn in that would forestall hospitals closing? It's re-expand Medicaid, stop the cuts. The problem with rural hospitals is they are not going to turn away the broken leg. or the burn or the car wreck or the elderly woman with cancer. They can't. It's not in their nature, and nobody would stand for it. They'll do the best they can, but they'll do a bad job if they can't get paid. So people without Medicaid still will get care, and they will have to try to raise their rates, and it's not sustainable, and that's why they're going under. When the Obamacare, Affordable Care Act, lowered the number of uninsured, all the rural hospitals were much better off. They at least got something, and they could keep their doors open and hope for eventual salvation. Now it's like, well, there is no hope. Our uninsured coverage, our uninsured patients will go up from 2% to 3% to 7, 8, 10%, and we just can't do it. We cannot do it. There are not enough, people that can pay $10,000 insurance premiums to cover all those people who can't pay anything. So, restore Medicaid. Short-term answer, long-term Medicare for all.
My answer would be actually, it's fairly simple, but it might be complicated to enact. I would nationalize all the ambulances and all the MT services and bring them under the fire departments. Part of the problem is that a $5,000 for an ambulance ride is completely unacceptable. We have trauma deserts where there isn't adequate coverage, and you could be up to an hour's ambulance ride to even get you to a hospital, or even longer in certain circumstances. If we can provide ambulances to every single fire department, even if they're a volunteer fire department, it throws more money into their budgets and gives them a much better chance of addressing the local needs of accidents and things like that than we currently have.
Next question.
Hi, I'm Sarah Duffy. I really appreciate that overview you gave of how we got to the situation we are right now with the healthcare over the years. And you seem to be able to read the tea leaves. And my question is, what do you think is going to happen with traditional Medicare? Do you see it all becoming like the Advantage plans and there won't be a choice anymore?
So can I pitch in on that one? Sorry. So the Advantage plan, like I said, I'm not yet ready for I'm going to get away from the speaker. Sorry. So the Advantage plan has some, by its name, advantages. It covers some things that the other system does not, right? But again, the things that the Advantage plan covers should have been folded in and covered under Medicare proper for everyone, instead of setting up a separate system in which there's a profit motive for people to get in. And you get Medicare, but you got to get gap insurance, and then it covers this, but it doesn't cover this. So you got to get an Advantage plan, or you got to get a supplemental, or you got to get this, and then pretty soon you realize I'm pretty far away from what they promised me. What they promised me, Medicare was going to take care of me when I got old, right? But now I've got to hire a specialist to bloody figure out how to navigate the system, right? So what I'm advocating is that the benefits that we want to cover as a society should be under one system, and everybody should have it. And the reason, so I'm not a doctor, but I'm a member of Physicians for a National Health Program. And they have a saying that says, everybody in, nobody out. And here's the reason. When I'm a congressman, I'm going to have government insurance, and you better believe it's good, going to be good government insurance, right? Thank you, by the way, for electing me. It'll be nice. But then I look at Medicare and Medicaid and everything else as a cost. It's those people. So I try to minimize that. And then I take money from lobbyists. I don't, by the way. I don't take money from lobbyists for healthcare. And I undercut this, right? And then you say, okay, we'll subdivide that a little bit. Not too many years from now, I'm going to be on Medicaid, no, Medicare, sorry. Now the people on Medicaid are still other, and I see them as I'm projecting myself on other people, not me, but then they still see Medicaid as just a cost to minimize. But if the people making the laws had to have the exact same system that you have, and that a poor person has, and that a billionaire has, it's going to be a better system. Because if I want it, and that's one of the tensions that I have seen in discussions with people, that people have said, well, I have good health insurance now, and I don't want to lose that. And that's fair. I have good health insurance. I want to be able to pay for additional insurance because I don't want to wait 3 months to get in to see a doctor. Set aside, you have to wait 3 months to see a doctor in the United States today anyway. I want to cut to the front of the line because I have more money. And that kind of rubs me the wrong way. It's kind of like petting a cat. You know, you can go one direction, it's fine, but you go the other way and it causes irritation. It's kind of like petting the cat the wrong way when people say that. Because if you don't want to wait 3 or 4 months, then nobody else should have to wait 3 or 4 months. We should build a system that doesn't have that wait built in. And the fact that you make more money than me doesn't let you cut in line when you're sick versus when I'm sick, or when my child is sick. If we build a system that is based on the rule of the jungle, where the rich and the powerful do what they want, and the rest of us do what we can, we're going to end up with this fragmented system, and we're going to end up with the same problems we're existing today. It has to be all in, nobody out, if they're going to make a fair system. That's why I'm in favor of Medicare for all. Anybody else wish? I'll take my papers out of your way. Sorry. Anybody else wish to comment?
May I? Exactly. And it needs to be universal, and it's a complicated bit of business, but it's, again, the uncovered care. The hospitals can't do that for free. They're going to raise your good premiums higher by 10% because they have 10% instead of 2% uncovered care. And as they make it harder and harder and more expensive, more and more fairly healthy people will say, I can't pay for insurance anymore. I'm going to have to show up at the ER if I get cancer and hope for the best. And then that's additional uncovered care. And so the premiums for the few people, it becomes fewer and fewer people. And Medicare, at least, has everybody over 65, which is a sizable fraction of the cancer population. And so, you know, we need that for everybody. We need everybody in. We can't have a system that has 3%. Not only is it immoral, in my opinion, it's bad for us. It's bad for the people who do have insurance because those people still need care. And the hospitals and doctors are going to come to us and to our insurance companies to get paid for those people. That is how it works. If everybody's in, then we can, and we cut down the administrative cost instead of being 17, 18% down to like 2 or 3%, which Medicare does, then we would have a whole bunch of money to buy Medicare Advantage type features like glasses and things for everybody in Medicare.
Simon, I think you were going to say something?
Yeah, my understanding is that the Medicare for All legislation includes vision and dental. I'm not a fan at all of Advantage because it pushes too much power into the private insurance. I am a great believer. You can tell I'm originally from the UK, so So I grew up with the National Health Service. I grew up with universal health care. And I'm struggling to find any defense for the US healthcare system because everything, all the incentives are in the wrong place. There's no way a shareholder of a private company should be between you and your doctor. That shouldn't exist. They should have no decision making. When you go and see your doctor, you want an answer from your doctor. And what happens here, the insurance company has to give permission. You know, I've had, I think, at least half a dozen drugs that were prescribed for me that the insurance company said, no, you're not having them. Some of them were expensive. And I think I've veered off the course of the topic a little bit, but I can talk more about what the UK system versus the US system is.
If there's a question on it, hint, hint, right?
So I kind of understand the system. I lived in Sweden for a time, and I, I was young back then, and I got an ear infection. So I used the system. I was a resident, not a citizen, but I had a little medical card. I walked out of there. I think I paid $20 for the medication. After I'd been seen by a doctor, not charged, didn't have to fill out all this paperwork, just my little card. So I guess my question for you, and that may lead into explaining the system that the UK has, is we have people that say, oh, well, I'll be paying all this money for these services that I don't need. I'll be paying for someone else. Seriously.
No, I've heard the argument.
So
You're right.
we're having trouble hearing. If you can speak closer to the mic.
I'm sorry. So I guess my question is, so you talk about comparison between the system we have right now and the universal single payer system that Sweden, UK, all these other places have. First of all, can you debunk that myth about, I'm paying for someone else's?
Do you have car insurance? Who else are you paying for out there to have an accident? That's exactly the whole point of insurance. So the whole idea. Sorry.
No, and then I'm going to sit down. But the other thing, I was to the healthcare forum in Bloomington, and Simon, you gave a really good rough rundown of how quickly the UK was able to establish the system that you have. Around World War II and all that.
Yep.
Do that.
Okay, I'll be brief on that. So, 1942, a study was created basically to figure out what to do after the war, and it was it's called Allied Services and Social Security, I think, and it was basically what to do with all the different services that were around, like pensions, workman's comp, and adding other things in, and essentially it created the document that founded the National Health Service, just to provide a universal single payer system where everything was free of charge at the point of delivery. That's the goal. When you get to the doctor's office, they don't ask you for money, they don't ask you for insurance company permission. It's just a case of you go see your doctor, you get treated, you go home, hopefully. And it took 6 years from the day the study was started to the foundation of the National Health Service, but it didn't really take 6 years. The first 3 years were defeating Hitler and fascism. And then the war ended, and then there was 3 years to actually go, we've got all these hospitals now, what do we do with them? And actually put it to the common good. But does that answer?
Yeah, I mean, the other argument is that, oh my gosh, it won't work in the US because it will take years to establish something like that.
We can do it quickly. We know what it's been done before.
Tag me in. Thank you. So in 1965, we started Medicare in 1965. It took a year, and we did it on 3x5 index cards. Okay. And now that we have the system established and the systems and the policies and everything established, extending that to more people shouldn't be as hard. Little example of what you were talking about in the British system. We'll be posting a video. I ran into a guy at a fair and he was telling me that he and his wife went to the UK and she broke a tooth on the ship. She got off, went to a doctor, and he said, I thought it was going to be like, oh, this is going to be expensive. This is going to be bad. I'm not in the system and all of this. And it's going to take forever. And they went in, no enrollment, no new patient, just I've got an emergency and I need help at a dentist, right? And he said, pretty quick, in minutes, not hours, somebody came out and took her back into a room, and a guy came in and started working on her, and I was like, when are we going to see the dentist? And he said, I am the dentist. And he fixed it. And then they went out front, and the lady behind the counter said, oh, I'm sorry, you're not in our system. And the guy's bracing, and she said, that's going to be like $120. She said, I'm so sorry to have to ask, but you're not in our system. It's going to be $120 to fix this tooth. And he's like, well, yeah, but what about the medicines? And she reached over and she said, yeah, that's in the 120. And he said, well, I don't have to go somewhere else. She said, no, right here, 120. He's like, done, sign. And he took the medicine and his wife and he ran, right? Never see that in the United States. I think you were itching to say something. Go ahead.
One of the points I want to make, we already pay for 43% of the health care in this country through our taxes. So to extend that wouldn't mean reinventing anything. We would just be including everyone in it. The lobbyist in Washington, I really have issue with. I just want to make sure I get the numbers right. I do believe it is about 100, I want to say billion, but I want to make sure that I'm saying the right number. Oh, I'm sorry. Lobbyists spend $100 million a year convincing our elected officials that we need to keep things the way they are. We need to keep employer-based because 43 of our country's billionaires are healthcare executives and CEOs. I have a problem with that, and that money could be used better. It needs to be in patient care and taking care of our people. I have an issue with employer-tied healthcare. The average healthcare policy costs $26,000 a year already. The individual for a family pays just a little under $7,000 a year out of their paycheck. The employer pays the rest of that. We are stuck with the insurance our employer offers. It often changes. Who our doctor is often changes, and we have no control over that. If we had a universal system, we could control who we saw versus being told who we can see. You are never alone in your doctor's office. The insurance company is the elephant in the room, and that will be the one who says, yes, you can have this medication. Yes, you can have this procedure. It's never the doctor making a decision with you on what's best to take care of you.
Next question. Yes, sir, come on up. We adjusted the volume on this, so when you speak into the mic, we're going to be testing the system while you're asking your question.
I don't talk very loudly anyway, so this will work for me. I'm Bob Brewer. I live here in the community. Closer? Well, we'll do that. It might be easier. Should have done this. All right, I'm Bob Brewer and live in the community. I've always had good health insurance provided by employer. And everything you say, practically, I agree with. I love it. It sounds good. It gets me excited. But do you have a plan to try to overcome those lobbyists that you were talking about? Because they have such great influence. They have the money. They have the people in place. And with all the things that you've said, that's one big caveat that sounds to me like it might not be possible.
It is certainly, thank you, it is certainly a very heavy lift, right? The issue that we face is that there are powerful and wealthy interests that are putting their interests in front of ours, right? And in a democracy, we're supposed to be looking out for the people, all of the people. And the only way we're going to do this, frankly, is we're going to have to start voting for people that want this, right? So legally, it can be done, but we have lobbyists and we have money that is interfering with that. And a wise woman was just talking to me right before this event saying we need to get money out of politics, right? And this is a great example of things that have been blocked literally for 80 years. We started talking about the possibility of doing this 80 years ago. And every year, the insurance companies say, yeah, I know there's problems and we got to get better. And once you see what's really happening, you can't unsee it. We are trapped in a usury and manipulative relationship with the insurance companies. They're like, baby, I love you. I'll take care of you. I want to make sure you get health care. I know it's not working out. I'm going to do better. Right? And we have tried many times. I talked about the Affordable Care Act. The Affordable Care Act, I like these things. I just bought them specifically for this, so I'm really happy to waive it. The Affordable Care Act was an attempt to work with the insurance companies to build a better system that works for everybody, right? And they've shown what they do in that system. So it's time to be done with it. We have to start fighting for what we want and need instead of fighting for the scraps that we think that they'll give us, right? Medicare was brought in 1965 by an act of Congress, and it made a huge difference in people's lives. The ACA cut in half the uninsured rate, right? We can do big things. We just need to screw our courage to the sticking place and start fighting for it. The fact that 50% of doctors, so let's talk about the political, really, so I'm done pontificating, I'll switch to the political, which is a tactical question that you really asked. 50% of doctors are now in favor, okay? And the insurance companies have gotten so bad about reimbursement with hospitals that hospitals spend and providers spend a huge amount of time just navigating that system. And enough people are going bankrupt and the expenses are going up that I think we can get the population behind the idea of Medicare for all. I think we can get the hospitals behind a system in which they'll get paid in 30 days. They'll get less money, yes, but they'll get paid in 30 days and their bureaucracy goes down. And 50% of doctors are in favor of it as well. So historically, hospitals and doctors, frankly, have been against it. and the population has had it good enough that it was a harder sell. And I think that the time has come for this, and we can sell it. And there's Physicians for National Health program and others are setting that up. And for the first time, the Democratic Party, I read something that said that we need in the next 2 years to be putting things together. As soon as we take back, I think we're going to take back the House this election, right? We can get a bill together, and there's bills already drafted. And when we take back the White House, we can push it through. If we're going to have Medicare for all, I think it's going to be signed off in the first 100 days of the next presidency. But we have to get ready for it. And we have to start putting people like me in Congress that are going to lay the groundwork so that we can pull, sorry, I shouldn't use that kind of imagery, so that we can initiate on day one of the first 100 days of a Democratic president. Okay. Good. Next question.
I think my question goes more to you. You're an ER nurse, correct? Okay. So how many cases have you seen where an emergency takes place and the person that's sick it could have been avoided based on preventative care? And now they're sitting in the emergency room with cancer of some sort, and the cost is so much more if they use the emergency room as a healthcare of last resort, rather than just doing routine checkups and preventative care. This other side question I do have is based on doctors, as far as actually practicing right now and having 25, 30 million more people in the healthcare system. Are we going to overload the physicians that we do have? And how do we step up to the moment where we add more physicians, and what government can we do to assist that?
We are already serving the uninsured. When EMTALA passed, that means that everyone that comes through the door in the ER, we take care of. As providers, we don't worry about their insurance, but at some point, the hospital needs to get paid. So we take care of everyone. I would say 50% of the people that I take care of on a daily basis do not belong in the ER, or the reason they're there could have been prevented. I have a lot of people in their 50s that lose employment. They are not able to find a job. They lose their health insurance the last day they work. They can't afford their medications, like blood pressure medications, and they come to us with emergencies, sometimes debilitating for the rest of their lives. They have strokes. We have diabetics come in that can't afford their medication, and they're very sick. It is the most expensive care coming through the ER, and they're so sick that they end up in the ICU. We're talking hundreds of thousands of dollars, and they have no insurance. We don't worry about that. As care providers, we don't even want to think about it. We see the patient in front of us, and we just want to do what's right for them. But it is very frustrating to see people come in, and you go through their med list, and they're like, oh, yeah, I haven't taken that in a couple months. And it's a blood thinner, because they couldn't afford it. I've seen people on Medicare, they're rationing their pills because they're not able to buy their prescriptions. They couldn't afford it. They're cutting their pills in half. I think somebody works all their life in this country and is a good citizen at the end of their lives. We shouldn't be treating them that way. I would say if we had universal health care where everyone had access to primary care, you would see the ER's busyness cut in half easily. And we're already providing the care for the uninsured. So I feel like it wouldn't tax the system anymore. We might see more primary care providers. I'll be honest, a lot of people don't want to go into it no more. There's not a lot of money in it. and it's a job that they want to do more specialized care where they might make a little bit more money. But I think with the universal system, they would be able to make more money. They would be able to be reimbursed fairly and wouldn't spend a good amount of their money just trying to get paid by insurance companies.
Next question.
I'm Bill Godfrey. Why aren't corporations in favor of this? They're paying a whole lot of money to cover insurance. When I was working at Kroger, they did away with spousal insurance. Around here, a lot of people are farmers. Their wife worked at Kroger just to have the insurance. Now, it would save them a whole lot of money. What can we do to get them on our side?
Anybody on the panel want to swing at that before I do?
Yeah. What you're basically describing is the burden on employers and lifting that burden off of employers and having employers understand that even just managing the healthcare plans is a burden. For every 100 employees you have, it takes one employee to manage the healthcare system. You have 300 employees, it's going to take 3 people to manage your healthcare program. You're looking at literally a 1% productivity hit just to manage the healthcare program. So on some of the margins that small businesses work on, that could be the difference between having a profitable year and the, going under, because if the margins are that small. So the other thing is tying it to insurance to employment creates a slavery condition where you are indebted to the company. And so you can't think about moving on or doing anything else unless you can jump to a similar situation with similar benefits. So those are the factors that I see.
I'm not doing that anymore, sorry.
If I could comment on that, I feel like having a universal health care plan is probably one of the most pro-business ideas that could be possible, because after World War II, just a brief history, employers were competing for employees. So they kept raising wages. So employees would go to the job that had the higher wage and they kept losing employees. And the government actually stepped in and said, hey, no more raising your rates. You're going to pay them what you're paying. We're going to put a freeze. So to offer employees a benefit, they started offering private health insurance to the employees. That is where it all started, and it was a horrible idea. If employers didn't have to worry about health insurance and picking premiums, that would free up a lot of money for buying equipment, innovation. Small businesses could compete with big employers. A lot of small business owners lose employees because of the health insurance. People could be an entrepreneur. They wouldn't be afraid to leave their job. They wouldn't be afraid because they have children at home to maybe go part-time so they can raise their children. Right now, you're locked in full-time because you don't want to lose your benefits. And it would also mean higher wages because employers, once again, wouldn't be taking that $20,000 a year and deducting that from what they're going to pay you because they know they're going to be paying that premium for you.
You actually just answered the question that I was about to ask about what would happen if we were to get rid of that in corporations. This, I guess, from Bob or Simon, is there anything else that you could expand on from that? We had a question online. What happens to coverage by corporations if we were to implement Medicare for all? Thank you.
So I'm going to ask Brad, how, as we make this transition, maybe I'll try to rephrase the question. As we make a transition to a universal healthcare system and firms are used to paying a sizable hunk of cash for their insurance and some tax money that they collect, of course, from themselves and from their employees for Medicare, how does that fold over into a net positive for the employee and for the company. I think I see it, but I'm going to let you try to explain it.
You're okay? Yeah, there we go. I'm going to try to interpret that question. We'll see if we get it right. What I hear a lot from people is, I have health insurance now, right? And I don't want to lose what I have. And I'll tell you this, that when I was working for the Navy as a civilian engineer, I had good health insurance. It was really good health insurance. And the premiums were reasonable. And I had a series of medical problems a couple of years ago. I'm better now, but I went through 4 surgeries and some other treatment and a lot of testing to get there. And I'm guessing my wife takes care of most of the finances, but I think that we probably spent maybe $6,000 out of pocket for all of that, for that insurance. And then I quit my job to run for office, and we went to my wife's insurance. So there was a change. And my daughter wasn't feeling well, and she went to the ER, and she got one of the tests that I had in that whole thing, and it was like $4,000 that we had to pay, and we had insurance. Okay? So you say, well, all right, but Brad, that's your fault because you had good insurance and you quit your job and you had to switch to other insurance. I was just talking to somebody that is still there, and they said, things are changing where I'm at, right? So what I hear in that question is, I don't want to lose what I have. And what I'm saying is, there is no guarantee that you will have that next year, okay? If you have good insurance now, that doesn't mean that next year it's not going to completely change, because you quit, you leave, your company goes under, or they just need to change their insurance policy because the rates have gotten so high, right? So first of all, don't get too comfortable with the idea that you got it good and it's always going to be good. You've got substantial risk even if you have a good insurance program, okay? And then the second thing is that in a universal healthcare system, everybody would get covered. So you would transition to a system that you get to pick your doctor, and you get to pick where you get your services, and you don't have to worry about whether your insurance company is going to change and whether next year your doctor is not going to be in that network, which tends to bounce around. So there's a lot of instability that people are really facing that they haven't really factored in compared to a universal system. Next question. Pardon.
So Simon, this question might be a little bit better towards you with your experience with TRICARE as well as growing up with the NHS, sorry. And my question is, what happens with the jobs? Because currently there's about 750,000 people employed across the country, either directly at health insurance companies or in the business of health insurance. You know, you mentioned 1% of the workforce at a company is going to be towards providing health insurance to the employees. How do we make sure that we're not just creating, 750,000 unemployed people all of a sudden?
The current Medicare for All bill actually addresses that by reducing the age of eligibility. So right now it's 65 for Medicare. The first year it'll go down to like 55. Second year it'll go down to 45. Third year everybody's included. That's the way it's written. What that does is that phases out the insurance companies. But the thing is that even with universal healthcare, you can still buy supplementary private insurance if you want to, if it's priced correctly. Nobody's taking that away from you, but what they're doing is they're providing a baseline that should cover everything that you would need, unless you wanted to opt for something elective, expensive that you can, plastic surgery or something that you can buy insurance for. And so the theory is that the cost of private insurance should go down because most of the risk is already covered by the national insurance pool that's going to provide universal health care. Does that answer the question?
Yeah, I think that this will be a pretty substantial increase in the size of Medicare. And yeah, a lot of people in the insurance industry are going to have some pretty relevant skills for administering the Medicare program. There's going to be jobs created. Yes, we're going to lose jobs. We're also going to create some jobs. What we are going to lose are jobs in doctors' offices and hospitals of people who are spending their entire career fighting to get paid for the heart transplant they just did, or for the dialysis that they did on Mrs. Smith, fighting just to get paid for a service that was clearly indicated. And yeah, that fight is going to be a lot smaller, so there will be fewer people on the administrative side and fewer people on the bureaucracy side at the hospital and doctor's office. But that's where we save all the money that is going to allow everybody to be covered.
And I wouldn't feel sorry for the insurance companies at all. I mean, you want to feel sorry for the people working them that are transitioning.
Don't get me started. They make their money by denying care.
Yeah.
That's how they make their money.
What's going to happen is that most of the insurance companies are going to transition to selling you life insurance. And the reason that they're going to do that is because you're going to have more disposable income because you're not paying premiums. And so they're going to offer competitive life insurance. And here's the thing, most of those life insurance policies won't pay out for 20, 30, 40 years. And so that's all near-term profit for them. So they're going to make probably even more money than they do now, just by pivoting.
Michelle, did you want to say something before I jump in?
Just real quick, my daughter worked from home for an insurance company for a brief amount of time. She was a high school graduate. She made $14 an hour, and her job was to review medical claims and find a reason to deny them. So I don't feel like those jobs aren't easily replaceable with other jobs. And it was shocking for me to find that out because I didn't know either. It is.
It is.
And she had 2 weeks training.
Well, and if it makes you feel any better about that, those jobs are going to be more, and they are currently being more and more automated, so they can be more efficient. So those jobs are going to be phased, a lot of those phased out anyway. The point that I wanted to make is that when you talk about fraud, waste, and abuse, if the people providing services through the insurance company were providing full value, and that full value was going to be administered by the government in the future, then there should be, as they pointed out, an equal number of jobs created that they could go to. But the fact is, the administrative costs for government administration of Medicare Part A and B is about 2%. And it's about 15, 17% in private insurance. And there's a lot of this, there's a lot of people that have been hired to fight, to say no, And then the hospitals have to hire people to say, oh, yes, you will pay for it. And there's a whole industry of people that we pay through our health insurance, which is part of the reason our health insurance is as high as it is, so that they can fight, right? That could be completely eliminated. The fighting is done. They don't have those issues in the Medicare system, okay? It's either covered or it's not covered. They're not trying to find reasons to deny care, right? Will it have an impact on some people? Yes, it will. But the waste in our system is what is being serviced. And we can't continue to say that's going to affect some jobs, so we're going to continue the fraud, waste, and abuse, which is primarily not in the government system, it's in the private system. And the profit.
Good question.
Yeah. Well, okay, well, so I'll say this, and I believe in the free market system for most things. There's a couple things that it doesn't work well for, okay? It doesn't work well in the healthcare system, and we can demonstrate that. And now I'm just going, this is just me complaining, I don't like it for toll roads either, right? Neither one of them should have a private system that I have to pay every time I drive by it. It just drives me crazy, right? We don't, in the very beginning, so we were talking about fire stations earlier. The first fire stations, I think Benjamin Franklin helped to set up one of the first fire stations in Philadelphia, I believe. What they don't mention is that was a for-profit fire station. And literally, you had to pay your monthly insurance to the fire station. And if your house caught on fire and you hadn't been paying, they would stand there and watch it burn until you gave them the money that you owed them from the prior. Welcome to the American healthcare system. Okay, that has to stop. Next question. All right, that seems to have killed the discussion. I'll try to be more congenial. Okay, any other questions? Do we have any questions from the outside? So I think we've covered all of the first round questions. Any additional? Ron, do you have any? Okay.
Let's have cookies.
Well, so that's a good idea. By the way, one of the times I went back and caused that whistling was because there was a peanut butter cookie back there that was calling me, and I had to leave it here until we were done. So we're about at time now, so I'm going to call it. I'd like to thank some people. I'd like to thank Monica Yane. Is it Monica Yane? Yes, but that is the correct name. Okay, I'd like to thank Monica for helping to pay for this venue. I appreciate her support. Christina Person, who's the Democratic chair, for all of her help in getting this set up. And she called me and says, hey, you want to do one of these out here? It's like, yes, I do. And then, of course, I'd like to thank my team that helped to put this together and all the support. And I'd like to thank all of you for being here tonight. Since this was actually your brainchild, would you like to take a minute? Is there something that you would like to say before we close?
Sure.
Yeah. I'll give you an opportunity. I yield the floor to Christina.
To the audience, I guess?
Yeah.
Okay. So this whole deal with healthcare in this nation means very much to me personally. And, I see the need, after living in Sweden, as a young woman, of course, I only knew the system. My parents, they had insurance through my father's employment at D&M in Connorsville, which was later Frigidaire and what have you. And the health insurance companies would change every time the company changed. And, I watched my parents struggle with that. filling out forms. Back then, you had to fill out a paper and the doctor had to sign it, and then you had to turn the stuff in. And then when my father, when he got older, I came to understand his relationship with the VA because he was a disabled veteran as well, and how that worked. And, the insurance company that he had when he retired, I think it was UMR or something of that nature, kind of like worked together with VA, but you always had to charge the insurance company first, and then VA would kick in, and there was always this waiting period. And it was just a rat race. And for me, I've went through my life with insurance at one moment and no insurance the next, depending on jobs, depending on, where I am at what stage in my life, where I've been anyway. So I understand what it's like to not have insurance, and I understand what it's like to have private insurance, and I understand what it's like to be on Medicaid and HIP. And totally, like many of you, we understand what it's like now through the Affordable Care Act and the marketplace. I've always, since I lived in Sweden and I experienced, used that system, and I watched my in-laws with their healthcare issues, working the system, working through the system to get themselves healthy and well, I realized, boy, we are missing out. We are missing out in this country, and we are allowing for-profit entities to get more money off of our illnesses, and it's just not right, guys. So, for Brad to be taking this to the next level, I've always been kind of like, politicians, they're not doing anything really for us. And it's felt that way for a long time. But I feel like, Brad is really stepping up by doing these healthcare forums. He has an objective. He's not just saying, hey, vote for me because I'm Democrat. That doesn't, I'm the Democrat chair, but just because someone tells me they're a Democrat, that doesn't mean that I'm sold on what they're trying to sell me, But he actually has an objective that's going to help us, all of us. Doesn't matter what political party we belong to. It doesn't matter what religion we are. We all, at some point in our lives, need health care. And this guy is fighting for us to get that established. And there are other great people like these folks here who are also in that fight, doctors, nurses, people from other countries who actually care about us and want us to see us evolve and get to a point where our government is taking care of the people and not the billionaires. So I thank Brad so very much, and I thank you all for joining us tonight and your questions. And I hope to see more of these forums, right?
Yes, ma'am.
That's good. Thank you, guys.
Thank you all. That concludes the formal portion. I'm going to shut off my microphone, and the cookies are calling. Thank you.